Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Hemorrhagic fevers. Introduction. Hemorrhagic fevers are a group of infectious diseases. They interfere with the way your blood clots. These diseases can also damage blood vessel walls, causing them to leak. The internal bleeding caused by hemorrhagic fevers can cause mild or major symptoms. Some hemorrhagic fevers may lead to death. There is no cure, and only a few types have vaccines to prevent them. This program explains hemorrhagic fevers. It discusses the symptoms, causes, and treatments of such diseases, as well as how to prevent infections. Hemorrhagic fevers. Hemorrhagic fevers cause damage to the organs and blood vessels of an infected person. They are caused by families of viruses. Some viral hemorrhagic fevers include dengue, Ebola, Lassa, Marburg, yellow fever. Hemorrhagic diseases happen around the world, but they are found most often in tropical areas. When they happen in non-tropical places, they are often found in people who have just come back from traveling where the diseases are more common. Animals in specific parts of the world often carry specific diseases. These diseases are usually limited to the places where these animals live. For example, Lassa fever is only found in rural areas of West Africa because the mice and rats that carry the virus are only found there. Humans can get infected through contact with infected animals. Sometimes humans can pass the infection to one another. It's hard to predict when and where an outbreak among humans will happen. Symptoms. Hemorrhagic fevers may have different signs and symptoms based on the type of virus, but the first symptoms may include a high fever, feeling tired or worn out, aching muscles, joints, or bones, weakness, dizziness. Although blood loss is usually not fatal, severe cases of hemorrhagic fever can cause bleeding from the ears, eyes, mouths, or internal organs. Infected people can also bleed under the skin. Other signs and symptoms of severe infections can include delirium, shock, problems with the nervous system, kidney failure, liver failure, coma. Viral hemorrhagic fevers can cause organ damage that could be fatal. They can damage the heart, lungs, brain, kidneys, liver, spleen, eyes. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. The first signs and symptoms of viral hemorrhagic fevers are also found in many other illnesses. For this reason, it's often hard to make a diagnosis within the first few days. If you have symptoms of a hemorrhagic fever, try to find an infectious disease specialist. A healthcare provider with expertise in infectious diseases may be able to identify what is causing your symptoms. Your healthcare provider will first perform a physical exam. He or she will ask you questions about your personal and family medical history. Let your healthcare provider know all of the countries you have visited and when. Your healthcare provider may ask if you have been around any mosquitoes, rodents, bats, other animals, or people who could have infected you. Your healthcare provider may take a blood sample and use other lab tests to make the diagnosis. Hemorrhagic fevers are very contagious, so blood tests and other lab work are usually done in special laboratories to keep other people from getting the disease. Causes. People can get viral hemorrhagic fevers, or VHFs, through contact with animals or other people who are infected. Animals that commonly carry the virus include rodents, bats, mosquitoes, and ticks. Each animal carrying one of the viruses is found in a specific geographic location. That means that usually each VHF is usually limited to the place where the infected animals live. Some of the viruses also can spread from one human to another and to places where these people visit or live. Some VHFs spread through insect bites. Others spread through contact with the semen or blood of infected people. Sometimes people can get sick if they breathe in the viruses that are found in rat droppings or urine. People can catch the illness when they travel to high-risk areas where the illness is common, but sometimes they don't have symptoms right away. They may not develop any symptoms until after they've been home for 3 weeks. If you live in a high-risk area or travel to a high-risk part of the world, you're more likely to become infected. Other factors that make you more likely to get sick include working outside or in places where rats live, working with infected people, slaughtering animals that carry the virus, sharing drug needles, having unprotected sex. Treatment. There is no known cure or treatment for most viral hemorrhagic fevers, but in some cases, the medication ribavirin may help prevent complications or shorten the amount of time a person is ill. Supportive care is vital for a person recovering from a hemorrhagic fever. Supportive care includes making sure that the person does not become dehydrated and has the right balance of electrolytes, treating other infections as needed, giving the patient oxygen if needed, keeping the patient's blood pressure stable, giving the patient a blood transfusion if they have lost a lot of blood. Sometimes plasma transfusions are used to improve blood clotting. Dialysis, a method of cleaning the blood using machines, can help some people whose kidneys have failed. Prevention. Preventing hemorrhagic fevers in developing countries is a complex problem without an easy answer. There are many social and financial challenges that can make outbreaks more likely in developing nations. Poor sanitation, lack of medical care providers and supplies, war. If you plan to travel to areas where VHFs are common, or if you live or work in these areas, be careful to prevent infection. Always use gloves, gowns, and face protection if you come into contact with body fluids or blood. A yellow fever vaccine is available. It can rarely cause serious side effects, but is generally considered safe. But the vaccine is not recommended for certain people, including pregnant women. A vaccine for Argentine hemorrhagic fever is also available. Scientists are trying to produce vaccines for other types of hemorrhagic fever. Avoiding mosquitoes and ticks in high-risk areas can help prevent infection. Avoid wearing shorts. Tuck your pants into your socks before going outdoors. Long-sleeved shirts are better than short sleeves. It's a good idea to cover your clothing in permethrin, but don't use it directly on your skin. Permethrin is an insect repellent. Try to stay inside during dusk and dawn. Mosquitoes are very active during these times. Use a mosquito repellent on your body and clothes that has DEET in it, 20 to 25%. Using mosquito coils and bed nets can help you prevent bites when you stay in tents or hotels. There are a number of things you can do to prevent rodent exposure if you live in an area with a high risk of VHFs. Store pet food and trash in containers that rodents can't get into. Take the garbage out and clean out the containers regularly. Doors and window screens should fit snugly. Keep your grass mowed close to your house. Trim brush to within 100 feet of your home. Keep materials such as bricks and piles of wood 100 feet or more away from your house. See your healthcare provider before you travel to a developing country. Make sure you have received any vaccinations you may need. Your healthcare provider can give you advice for staying healthy while you travel. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Hemorrhagic fevers are a group of infectious diseases. They interfere with the way your blood clots. These diseases can also damage blood vessel walls, causing them to leak. Some viral hemorrhagic fevers include dengue, Ebola, Lassa, Marburg, yellow fever. Hemorrhagic diseases happen around the world, but they are found most often in tropical areas. When they happen in non-tropical places, they are often found in people who have just come back from traveling where the diseases are more common. Hemorrhagic fevers may have different signs and symptoms based on the type of virus, but the first symptoms may include a high fever, feeling tired or worn out, aching muscles, joints, or bones, weakness, dizziness. Although blood loss is usually not fatal, severe cases of hemorrhagic fever can cause bleeding from the ears, eyes, mouth, or internal organs. Infected people can also bleed under the skin. People can get viral hemorrhagic fevers, or VHFs, through contact with animals or other people who are infected. Animals that commonly carry the virus include rodents, bats, mosquitoes, and ticks. There is no known cure or treatment for most viral hemorrhagic fevers, but in some cases, the medication ribavirin may help prevent complications or shorten the amount of time a person is ill. Supportive care is vital for a person recovering from a hemorrhagic fever. Preventing hemorrhagic fevers in developing countries is a complex problem without an easy answer. If you plan to travel to areas where VHFs are common, or if you live or work in these areas, be careful to prevent infection. Vaccines for yellow fever and Argentine hemorrhagic fever are available. Thank you for using Explain.